just from my Minnesota perspective, I'll just put in a few words what I'm going to be working on and what I hope will be part of this debate, and that is that we put some quality standards in place. When you look at what Mayo has done and what some of the other Minnesota healthcare providers have done. Mayo, if you just look at what they do in the last 4 years of everyone's lives, of their patients, and you look at how the families react and the positive reactions they have, and then you look at what's going on in the rest of the country, if the rest of the country used the same protocol that Mayo used in the last 4 years of people's lives, we would save $50 billion over 4 years nationally. That just gives you one slice of what we're talking about here. Also, the geographic disparities issue that I hope our panel will address a little bit is something else I care about. The idea that in Florida and Miami, it's always fun to take on Florida during a presidential year, but in Miami, it costs twice as much to treat a Medicare patient as it does in Minnesota. Now, a little bit of that, probably less than half, is cost of living, but there's clearly something wrong here when it comes to the geographic disparities and how the whole system has been set up. So that's something we just did a forum I did with Senator Durenberger and Denny Cortez with the Mayo Clinic, a few weeks ago on this issue. So I hope that's something that's going to be brought in the debate as we look at quality standards in a bipartisan way. Rural health care is something important to our state that we realize that one size doesn't fit all. The drug issue, which we've been using some examples of where prices have been jacked up with some of the prescription drugs when it shouldn't happen. And then finally, the long-term care issue, which I'm not sure we're going to be able to get into this healthcare debate this time, but it's certainly something we're going to have to think of as we go forward, as we see these enormous demographic shifts in our population. And we really haven't changed the rules in terms of trying to make it easier for people to stay at home and things like that. So those are some of the things on my mind. But I will tell you the politics of this has changed. This is no longer the last time when the Clintons put out their healthcare plan and some of the industries ran those Harry and Louise ads against it, showing how they thought it was too complicated. I introduced Hillary Clinton at something about a year ago, and I said that Harry and Louise are now supporting the Clinton plan because they're on Medicare Part D and they're in the donut hole. So there has been a shift, and some of it's small businesses that are struggling to keep a pregnant employee on health care, and they want to do it, but it's just too expensive. It's large businesses who are having trouble competing internationally because other countries' healthcare systems cost less. So this is not just any longer sort of an individual consumer issue. It is a major piece of our economic puzzle as we go forward. And I'm just excited that for this great panel, Larry, and that you have Senator Bennett, and I look forward to working with all of you when we convene the next Congress. I believe it's going to be the #1 domestic issue, and these kinds of discussions are going to come out of the Humphrey Institute seminar room and into the big room in the Capitol, and I'm hopeful we'll get something done. Thank you very much.